Hello and welcome to our new topic. This session introduces a highly integrated area of pharmacology where physiology directly translates into therapeutic action. The parasympathetic system represents the body's baseline regulatory mode, and the drugs we are about to explore essentially work by enhancing or mimicking this natural signaling. Rather than imposing artificial effects, they amplify an already active system. This makes understanding normal physiology absolutely central, because every pharmacological effect we discuss will simply be an extension of what the body is already designed to do. So, let's start. The learning objectives are shown. Please take a look. The objectives here are not just about knowing drug names, but about building a structured way of thinking. Classification provides the framework, mechanism explains behavior, and from mechanism naturally follow both therapeutic uses and adverse effects. If this sequence is understood clearly, pharmacology becomes predictive rather than memorized. The goal is to be able to look at any parasympathomimetic drug and immediately anticipate where it will act, how it will act, and what clinical consequences will emerge. Autonomic nervous system is an important part of nervous system. Broadly speaking, it has two divisions, sympathetic and parasympathetic. This visual highlights the dynamic balance between sympathetic and parasympathetic systems. One prepares the body for action, while the other restores and maintains internal stability. Together, they work to maintain a balance, which sometimes involves opposing each other's actions, as well as supporting each other in certain situations. While sympathetic system prepares for survival, hence named as sympathetic, the parasympathetic is not anti-sympathetic but works parallel, hence the name parasympathetic. Most organs receive dual innervation, but under resting conditions, parasympathetic tone predominates. This explains why enhancing parasympathetic activity often produces effects that feel physiologically normal, whereas blocking it leads to exaggerated sympathetic dominance. Different tissues respond differently to the same neurotransmitter because of receptor diversity and intracellular signaling pathways. Acetylcholine can inhibit the heart, stimulate glands, or contract smooth muscle depending on receptor subtype and tissue distribution. This concept is critical, because it explains why drugs do not act randomly but follow predictable patterns based on receptor biology. This diagram illustrates the anatomical and chemical organization of autonomic transmission. Acetylcholine is the most commonly found neurotransmitter, as it is released by both pre- and postsynaptic neurons in parasympathetic system, hence also called cholinergic system. The neuromuscular junction is also cholinergic. In addition, in sympathetic system, the presynaptic neurons are also cholinergic, and some postsynaptic sympathetic neurons, innervating skin and small cutaneous vessels are also cholinergic. Thus, sweating and gooseflesh responses seen with sympathetic stimulation are actually cholinergic responses, and hence parasympathomimetic drugs often show this response. Thus, while acetylcholine is used at the ganglionic level, norepinephrine becomes the primary neurotransmitter at most sympathetic effector sites. The adrenal medulla adds another dimension by releasing epinephrine directly into circulation, effectively acting as a hormonal amplifier of sympathetic activity. Hence the other name of sympathetic system is adrenergic system. The parasympathetic system represents a coordinated physiological state focused on conservation and restoration. Energy is directed toward digestion, nutrient absorption, and maintenance functions. When this system is pharmacologically stimulated, these same processes are exaggerated, leading to increased secretions, enhanced gut motility, and reduced cardiac activity. The effects listed here represent a systemic pattern rather than isolated actions. Eyes constrict, glands secrete, the heart slows, and the gastrointestinal tract becomes more active. These responses occur simultaneously because the parasympathetic system operates as an integrated network. When drugs enhance this system, the resulting effects mirror this coordinated physiology, which is why adverse effects are often simply exaggerated normal functions, and we call them type A adverse effects, A for augmented response. Acetylcholine acts through two major receptor types, muscarinic and nicotinic, with fundamentally different mechanisms. Muscarinic receptors produce slower, sustained responses through G proteins, while nicotinic receptors generate rapid depolarization through ion channels. This distinction explains why skeletal muscle responds instantly, whereas glandular or cardiac effects develop more gradually. This sequence illustrates the life cycle of neurotransmission, from synthesis to inactivation. The key step for pharmacology is the breakdown of acetylcholine by acetylcholinesterase. By interfering with this step, certain drugs prolong the presence of acetylcholine in the synapse, thereby amplifying its effects without directly activating receptors. Thus, the majority of drugs that stimulate or inhibit the parasympathetic nervous system target steps 9 or 10 as shown here. Direct-acting agents bind to acetylcholine receptors and activate them. Their effects depend on receptor selectivity. Muscarinic agonists primarily influence organs such as the heart, glands, and smooth muscle, while nicotinic agonists affect neuromuscular junctions and autonomic ganglia. These drugs essentially act as substitutes for acetylcholine. Indirect-acting agents take a different approach by inhibiting acetylcholinesterase. This prolongs the half-life of acetylcholine in the synaptic cleft, leading to enhanced stimulation of both muscarinic and nicotinic receptors. The distinction between reversible and irreversible inhibitors is crucial, as it determines both duration of action and clinical safety. Acetylcholine itself has no therapeutic use because it is rapidly degraded. Drugs like bethanechol are more stable and selectively stimulate muscarinic receptors, making them useful in conditions such as bladder atony. Pilocarpine and carbachol extend these effects and may also interact with nicotinic receptors, leading to broader physiological responses. Nicotinic agonists produce widespread stimulation of autonomic ganglia and neuromuscular junctions. It should be noted that stimulating autonomic ganglia results in stimulation of sympathetic and parasympathetic responses. However, it depends upon the organ system to show the effects because one of the systems would dominate. Hence, sympathetic response dominates in cardiovascular system while parasympathetic dominates digestive system. Back to drugs again. Nicotine demonstrates generalized stimulation followed by depression, while succinylcholine is used clinically to induce muscle relaxation during anesthesia. Its initial depolarization causes transient muscle fasciculations before paralysis sets in. Acetylcholinesterase inhibitors are categorized based on duration of action. Short-acting agents act briefly and are useful for diagnostic purposes. Intermediate agents are used therapeutically, and long-acting agents, particularly organophosphates, produce prolonged effects due to irreversible enzyme inhibition. This classification reflects how tightly and how long the drug interacts with the enzyme. Reversible inhibitors allow controlled enhancement of cholinergic transmission. Drugs like neostigmine and pyridostigmine are primarily used in myasthenia gravis, improving neuromuscular transmission. Physostigmine crosses the blood-brain barrier, making it useful in central toxicity, while drugs like donepezil are designed specifically for central nervous system effects in Alzheimer's disease. Irreversible inhibitors form strong covalent bonds with acetylcholinesterase, leading to prolonged enzyme inactivation. While some had limited therapeutic roles, most are associated with toxicity. The accumulation of acetylcholine leads to excessive stimulation of both muscarinic and nicotinic receptors, producing a cholinergic crisis that can be life-threatening. Thanks for watching. For a more complete discussion, don't forget to watch our next lectures on parasympathetic antagonists. Don't forget to like, subscribe, and share. Happy learning!